everyone! Today we are going to learn about drugs for hemodynamic disorders. First, let's recall the previous material about the disorder itself. Hemodynamic disorders are divided into several types. How many are there? Do you remember them? Then write it down in your notes. In this video, we will also divide the drugs into 3 to accommodate this type of disorder. Without further ado, let's get started. There are 3 kinds of drugs for hemodynamic disorder. First, cardiovascular drugs, such as drugs acting on the renin-angiotensin system, calcium channel blockers, vasodilator, drugs for hypertension, angina, heart failure, and many more. Second, drugs acting on the blood, such as anticoagulant, antiplatelet, and thrombolytic. Third, drugs that affect fluid and electrolyte balance, such as diuretic and agents affecting the volume and ion content of body fluids. In this video, we will only discuss a few types of drugs. Let's start with drugs for hypertension. As you already know, hypertension is defined as blood pressure level above the normal range. To normalize the pressure in mild hypertensives, you can do a lifestyle modification such as weight reductions and regular aerobic exercise. However, adequate BP control usually requires the lifelong use of antihypertensive drugs to reduce cardiac output and or total peripheral resistance, such as thiazide diuretics that cause a fall in blood volume and cardiac output, angiotensin-converting enzyme inhibitors or ACEI, and angiotensin II receptors blockers or ARB that reduces total peripheral resistance, eplerenone, and selective aldosterone receptors antagonists that affect the renin-angiotensin-aldosterone system. Calcium channel blockers or CCB that used for their vasodilating properties, beta blockers that reduce cardiac output, and alpha-1 receptor selective blockers that cause vasodilatations to treat hypertension. All cells require lipids or fats to synthesize membranes and provide energy. Lipids are transported in the blood as lipoproteins. Hyperlipidemias are abnormalities of lipoprotein levels which promote the development of atherosclerosis and coronary heart disease or CHD. The treatment of hyperlipidemias aims to slow or reverse the progression of atherosclerotic lesions by lowering LDL-C or low-density lipoprotein cholesterol and to raise HDL-C or high-density lipoprotein cholesterol. Treatment often begins with a low-fat, high-carbohydrate diet which will change to therapy with lipid-lowering drugs if the diet fails after 3 months. One of the drugs is statins, which reduce CHD and the mortality it causes. Statin acts by reducing hepatic synthesis of cholesterol that increases the clearance of LDL, IDL or intermediate density lipoprotein, and VLDL or very low density lipoproteins from the plasma. Statins also modestly increase plasma HDL-C levels by an unknown mechanism. Angina pectoris is an episodic pain or squeezing sensation in the chest caused by reversible myocardial ischemia. It has 3 forms: stable, variant, and unstable. The goals of treatment for stable angina to control symptoms and to stop the progressions of underlying coronary heart disease. One way is to use anti-anginals. Beta-adrenergic receptor blockers or beta blockers and nitrovasodilator will lower O2 demand by decreasing myocardial contractility and wall stress. The difference is beta blocker will block a vicious cycle that increases ventricular and diastolic pressure, while short-acting nitrate will dilate veins and arteries, thus reduce preload and afterload. Meanwhile, CCBs prevent angina mainly by causing systemic arteriolar vasodilatations and decreasing afterload. They also prevent coronary vasospasm, making them particularly useful in variant angina. The next are four classes of drugs for treating multiple disorders of the cardiovascular system. The sections will explain in more detail the uses and side effects of these four drugs. Beta blocker are used to treat angina, cardiac arrhythmias, myocardial infarction, and chronic heart failure. However, there are adverse effects of beta blockers such as exercise intolerance, excessive bradycardia, and negative inotropy. Vasodilatations by beta blocker also cause fatigue and cold or tingling extremities. Next, ACEI and ARBs are used to treat hypertension, heart failure, myocardial infarctions, and to protect against renal complications in diabetes. Apart from cough, ACEI and ARBs share common contraindications and side effects like hyperkalemia. The class of CCBs is called dihydropyridines or DHP. DHPs are currently first-line agents for treating hypertension and all forms of angina. The non-DHPs, verapamil and diltiazem, are also used for these conditions and for supraventricular cardiac arrhythmias. Adverse effects of the DHPs are headache, flushing, and edema. The non-DHPs can cause powerful negative inotropic and chronotropic effects, and verapamil can cause constipation. Antiplatelet is used to treat arterial thrombi and anticoagulant is used to treat venous thrombi. For antiplatelet drugs, aspirin is most widely used. It irreversibly inhibits platelet enzyme, which act to inhibit platelet activations and aggregations. For anticoagulants, heparin is used. It activates antithrombin, which inhibits thrombin and blood coagulation factors. But the unfractionated heparin causes thrombocytopenia in some patients. Therefore, they may use low molecular weight heparins or LMWH because of their longer half-lives, predictable dose response, and rare cases of thrombocytopenia. LMWH only binds to antithrombin and is therefore more effective at inhibiting factor X. Warfarin, on the other hand, is only effective in vivo. Although slow in onset, it provides effective support for 5 days. Numerous factors including disease and drugs affect the sensitivity to warfarin, so blood tests must be used routinely to monitor dosage. Alright, this is the end of today's lesson, everyone. I hope you are still in high spirits to learn more about other types of drugs for hemodynamic disorders and their indications and contraindications. In the next video, you will also learn about a drug called anti-cancer. This drug is used to treat cancer and neoplasms, such as immunostimulants and even chemotherapy. So stay tuned. Thank you and goodbye.